the U.S. is now averaging more than 237,000 new daily cases, and several states are near all-time peak COVID hospitalization levels. Now, the stark rise comes as the CDC announced it's cutting the recommended isolation period for asymptomatic infected Americans in half. Instead of staying away from other people for 10 days, the CDC now says stay home for just 5. That's if you're asymptomatic by day 5. Now, the agency says the change is driven by data showing most COVID transmission happens 1 to 2 days before someone has symptoms, and in the 2 to 3 days after. I want to get straight to CNN senior medical correspondent Elizabeth Cohen, because Elizabeth, this was a major change. What kind of precipitated this?
What precipitated it, Phil, was that statistic that you just gave, where they said, look, if you're most symptomatic right before and just in 2 or 3 days after exposure, why are we keeping people out for 10 days? They started to see we're losing doctors, we're losing nurses, we're losing people who work, for example, for airlines, which is why you're seeing so many canceled flights. So they said, let's take these steps. And I must say, when I talk to infectious disease experts who have always feel very free to criticize the CDC and do so often, they actually were really in support of this. So let's take a look again at what you were just talking about. So the CDC used to say isolate for 10 days if you have COVID. Now they say if you're asymptomatic, you have COVID, but you're asymptomatic or you have symptoms and they're getting better, isolate for 5 days and then wear a mask around others for 5 days. Now, let's say you're exposed. Someone in your family, for example, has COVID. You don't have COVID, but you have been exposed. They used to say to quarantine. Now they're saying if you've been vaccinated and have received a booster, or if your second shot was within the past 6 months, no quarantine is necessary, but do wear a mask for 10 days. The reason for that, the CDC says that as long as you've had a booster shot, that you are 75% protected against Omicron infection. So they're saying if you're 75% 75% protected against Omicron, you're not sick, you don't have it, you're not showing signs, why should you be quarantined? So, this will really come into play as Omicron starts spreading in bigger numbers across the United States. We'll see how this new policy works out. Phil?
Yeah, no question about it. I do have one quick follow-up. The CDC just announced the number of new cases caused by Omicron was less than 60% last week. I was a little confused when I saw that number compared to what we've seen the last couple of weeks. What do you make of these new numbers?
Yeah, it's really confusing what's happened here. And I'm going to spell this all out and try to sort of go slowly. So the CDC every week puts out reports, all the new cases out there, X% are Delta, Y% are Omicron, et cetera. They've been doing this throughout the pandemic. So CDC previously said that the week of December 11th through 18th, they previously said that new cases were 73% Omicron. And everyone was like, wow, that got very big very quickly. Now they're saying, we're revising that estimate. We think it's actually 23%. That is obviously a gigantic difference. And they say the week of December 19th through 25th was 59%. So Omicron does not seem to be spreading quite as quickly. Delta is still holding its own. How did this happen? It is unclear. One thing that we know, people think, Phil, that we do genetic sequencing for every case. We don't. We have to do estimates. We do a few and then we estimate. But it's a bit of a problem that this happened because you start making treatment decisions based on these numbers, and that number appears to have been wildly off. Phil?
Yeah, and that might even be an understatement. Still, evolution in real time. Elizabeth Cohen, thanks for explaining it to us slowly. Appreciate it as always. All right, I want to bring in now former Baltimore Health Commissioner, Dr. Leana Wen. And Dr. Wen, before we kind of go through things here, I want you to take a listen to how Dr. Anthony Fauci kind of walked through the new guidelines from the CDC on CNN last night.
So it just makes sense if you keep them out for 5 days, keep them isolated for 5 days, then get them back doing their job, doing their work, keeping a mask on to protecting themselves from infecting other individuals. So I don't think it's confusing. I think it's a rather crisp recommendation.
So, Dr. Wen, I think one of the questions, look, the CDC was citing research and science and data behind the decision here, but I think there's been some question right now, is this, because of the scale of the spread, a decision about keeping businesses open? Is it a medical decision? Is it a political decision? Is it all of them combined? Where are we on this?
Well, Phil, I'm relieved that the CDC came out with this guidance because we are facing the imminent collapse of so many functions in our society. We already are about to surpass the peak of COVID cases last winter. And by the way, we are vastly undercounting rather, because people are unable to get tests, and also rapid tests are not being reported to public health authorities. We could very well get to the point of having 1 million new COVID infections every day. When we're at that kind of level, you can't keep people out for 10 days in isolation because we're not going to have police officers, we're not going to have firefighters, we're not going to have food service workers, we're just not going to have a functioning society. And so I'm relieved that the CDC came to this decision. It is based on the science as well. Although I will say, ideally, what we really want is to have a test in order to exit isolation to make sure that you're no longer infectious. But as we know, there aren't enough tests. And so I think this is the best of both worlds, if you will, that it is really a practical decision based on science, but ultimately driven by practicalities, because that's what public health is about. It's about meeting the realities on the ground. It's not about aiming for perfect. It's recognizing that we are in an imperfect and pretty dire situation. And this is the reason why we have to shorten that isolation period.
But you hit on a really good point. When I was reading through the new guidance yesterday, I kept waiting for the sentence that said once you test negative or test negative twice with an antigen test. You know, the NBA shortened their isolation period, but had the condition that players can return as soon as 6 days after testing positive if testing shows they're no longer infectious. Is a dearth of tests why the CDC didn't issue a similar prerequisite here?
I believe so, and I wish that they just came out and said it in the same way that back last March when the CDC was not recommending masks and was giving all kinds of other reasons for why masks were not recommended. I wish that they had come out then and said the real reason is that we don't have enough masks for healthcare workers, and therefore we should be saving these high-quality masks for healthcare workers. Not that masks aren't needed, but that we don't have enough masks. I think this is the same thing here too. Tests actually are needed in order to exit isolation. But if we don't even have enough tests right now to test symptomatic people, then we cannot possibly issue a guidance for all of America to exit isolation that way. So practical reasons, and I wish they were forthcoming about the practical aspects of why they're making this decision, which I still believe is the right one.
Yeah, it's a big question mark for me, though I think that's probably the likely answer, as you said. Last one before I let you go. We've been watching cases, pediatric cases of COVID, I think skyrocket to some degree, at least in places like New York City. They're anecdotal, but we've seen them jump. There's no question about that. Pediatric hospitalizations in New York City increased fivefold in less than a month. Another hospital, Children's Hospital in Chicago, quadrupled in a week. Close to half of all COVID tests at Children's National Hospital in D.C. are coming back positive. Your mom, I'm a dad with 2 unvaccinated kids out of 3. What are you saying to parents in terms of advice as we all look to school restarting here in about a week in terms of how to manage this moment in time?
Yeah, it's a dangerous time for our children. The spike in infections that we're seeing in children is not unexpected because we're seeing this spike in adults. And we know that people who are vaccinated and boosted are very well protected against severe illness. But our young children, many of whom are still unvaccinated, are not protected because they're not vaccinated. And so I would say for children ages 5 and above, get your vaccine, or to the parents of these kids to get these children the vaccine that will protect them. For children younger than 5, the best that we can do is to surround them with people who are vaccinated and boosted. I would still say send your children to school, but ideally, again, the schools should be implementing these protective measures that we know are effective. We know that masking in schools, especially with the high quality masks, are very protective. We know that testing can help to keep kids in school safely. So those are the types of measures that we should be implementing. Keep your kids in school, surround them with people who are vaccinated, and reduce risk in other ways. Don't also have indoor play dates. Focus on keeping our kids in school learning.
Yeah, there are roadmaps, and there were clearly funding to have schools prepared for this moment, even if we didn't want this moment to come. Dr. Nguyen, appreciate it, as always.